Hi and welcome to this week's episode of Wellness Wednesdays. This week we're going where others fear to tread on Wellness Wednesdays. We're going to talk about the prostate. So we will have all had relatives, we may even have had it ourselves, where the doctors told us we've got prostate. Well, what is prostate and what can we do about it? Well, for the ladies watching, you may have gentlemen in your life, maybe your husband, partner, father, grandfather, and it will be relevant to you about those. But to you personally, if you're a lady, you need not worry because the prostate is a male-only organ. Now, most people have no idea what the prostate gland is. It's this mythical thing that lives somewhere up the back passage and nobody seems to know what it is. So I'm here to explain a little bit for you. So the prostate gland, in a nutshell, is like a donut with a hole in, and this donut lives beneath the bladder, and the urine pipe goes through the centre, through the hole. And the function of the prostate gland, it only has one function, and that is to produce the fluid that sperm live in when they go and try and find an egg to fertilise. It's as simple as that. That's all the prostate gland does. It generates that fluid. The prostate gland develops through childhood and into early adulthood, and then it sits there and does very little other than that one function. However, the prostate gland responds to testosterone and it grows through testosterone exposure. So as blokes, we have testosterone in our bloodstreams all the time, and because we hopefully tend to live several decades, that decade's worth of exposure to testosterone means that the prostate gland grows every single year in response to the testosterone that it's exposed to the point where by the time you get to 50, you've got a 50% chance of having an enlarged prostate. By the time you get to 75, you've got a 75% chance, and so on and so forth. So by the time you reach the giddy heights of 100 years old, you're guaranteed to have a big prostate gland. Nothing you can do about it. It's as simple as that. And so that's fine, but sometimes having a big prostate gland can be troublesome. What do I mean by that? So as I've already said, the prostate lives underneath the bladder with the pipe that the urine comes out of through the middle. And as it grows, it can grow outwards, like a donut getting bigger, or it can grow inwards, and the hole can get smaller. And just like if you were to stand on a hose pipe in your garden at home, as you start to clamp down on the urine pipe, the flow of urine tends to get less. So us blokes, we all know, we've been into the pub when we were younger and there's been an old man stood next to us at the urinal and they're complaining that they either can't start the urine flow or it's dribbling into their boots. That's typical prostate troubles. The other thing is that if that happens, you tend not to empty your bladder very well, so you tend to find that on a night time you will end up going to the toilet more often because as you lie down, the pressure is relieved slightly and you feel the need to go to the toilet more often than you would otherwise. Now in medicine, we tend to say that 2 to 3 times a night is normal if you need to go and empty your bladder across the ages. If you're starting to go 5, 6, 7 times a night, then it's a sign that you should really be speaking to your doctor about it because there's all sorts of weird and wonderful things that we can do to relieve the issue. We've got all sorts of pills that we can do to relax the muscle around the prostate gland and open that pipe hole back up again. Sometimes we need to go in down the entrance to the penis and into the prostate and fire a laser at it and core the prostate gland back out again to open that hole up and create a lovely free-flowing flow of urine. Now, sometimes we can have a bit more sinister problem with the prostate, which is prostate cancer. Every man's worst fear. However, fortunately, prostate cancer is one of the most treatable cancers in men, and it's something that we can catch quite early. So how do you diagnose prostate cancer? Well, everybody these days has heard of the PSA test, the prostate-specific antigen test. PSA is an okay blood test. The problem is people think that you have the blood test, it's negative, that means you're fine. That is not the case. There are what's called false negatives. So you can get a negative PSA and still have prostate cancer. Equally, you get false positives. So you can have a positive test and not have cancer. So how do you work out what's what? Unfortunately, one of the best tests still available is a combination of the PSA and this, the experienced finger. Now this finger's been up more bumholes than you've had hot dinners, but That's good for my patients because I know what a normal prostate feels like and I know what an abnormal prostate feels like. And in combination with an experienced examination and a good PSA test, combined with your symptoms, you can usually find the right course of action. So, if you have any of the following symptoms: waking up in the middle of the night, going to the toilet more often than normal, struggling to initiate your flow of urine, dribbling or poor stream, finishing at the urinal but then having to go straight back because you haven't emptied your bladder properly, or blood in your urine, or frequent water infections past the age of 60, any of those symptoms whatsoever, go and see your doctor and get checked out. It's probably an enlargement of the prostate gland, but until you go and get examined with a blood test, you won't know for certain. All for now. See you next week.
Call the one you know, Halo Physio.